of Organic Health Movement, checking in for Deep Sea Dive, episode number 5. It is my honor to welcome Chris Hall, the president of Micronutrient Infusions, to the podcast today. I've known Chris for a couple of years now, and I've benefited tremendously from some of the infusion therapies that he offers, as well as some hyperbaric oxygen therapy. And all around, Chris is a very knowledgeable, really kind, compassionate guy that I am totally excited to have on the podcast. Today, we're going to be talking a little bit about the impact of athletic training on physiological function and some nutrient therapies that we can incorporate into our regimen in order to mitigate the effects of oxidative stress and some other impacts of athletic training. A little bit about Chris. He's here to help patients through an amazing company which provides the highest quality services, including intravenous infusions and oxygen therapies. He's a big believer in the benefit of these therapies making a regular impact in the lives of his patients. Increasing nutrient and oxygen levels can have a profound effect on any person's quality of life and the ability to live to the fullest, whether that's somebody suffering from chronic disease or somebody just looking to improve their health. I can definitely say, and I know Chris would agree, that he provides an amazing environment for healing. In addition to that, he's passionate about educating and assisting people in regaining proper health and immune function through detoxification, dietary changes, exercise, meditation, lifestyle changes, and, of course, just overall mental and emotional mindset to bring balance into their lives. So, Chris, welcome to the podcast.
Thank you, Zavi. Thank you for having me today.
Absolute pleasure. So, for the listeners who are a little bit new to your therapies and what you do, I'd love for you to just kind of introduce how you've set up your business, the therapies you offer, and how long you've been in business.
Will do. So the company was founded by my wife and myself back in 2001. The company name is Micronutrient Infusion Services. We did initially start out with more of a nutrition practice. My wife has a degree in nutrition, and I'm a herbalist by nature. But over time, we found that the supplements that we were providing to people as they were progressing through their treatment plans ended up reaching a point of plateau to where we couldn't get them to go any further. We also started running into issues of absorption with chronically inflamed gut tissue. This was, of course, during the time when celiac became more widely known and more testing came about for it. Gluten intolerance by itself, or gluten sensitivity, let alone celiac, is a problem for a significant portion of the patients that come in. So we started gearing the practice more toward intravenous therapies and oxygen therapy. At this point, we currently offer 17 different IV formulations of various different types, primarily vitamin, mineral, amino acid, or antioxidants. We also focus on some of the ozone oxygen therapies and also hyperbaric oxygen.
That's fantastic. So you cover a broad spectrum of different infusion therapies. And I love that you said when you were just getting the business started that due to a lot of supplementation techniques and the high prevalence of inflamed gut tissue that we have in our modern Western society, that it was difficult for people to absorb those nutrients. And so you took the intravenous route, which I can say for myself has made a big impact on my health. Just doing the Jumpstart program last year, which you could get into, was hugely beneficial. And I think one of the things that most people need to know is that aside from maybe being afraid of needles, these therapies are very much non-toxic, and a lot of the infusions, minerals, vitamins, so forth are naturally occurring in your body in foods, but due to our lifestyle, they become depleted. We're living in a very toxic environment. So I think these can be a huge, huge plus and added boost to your overall health, immune function, and so forth.
That's really the key to what we do, is providing a natural foundation of nutrients to the cells that need them in order to be able to regain the strength or even mitochondrial function that could be missing. And because we do live in that toxic environment, detoxification is also something that is extremely important. And we want to make sure that I still take supplements. we can't do everything through IV. Every morning I have my handful of supplements, and every night before bed, there's more. We can only do a certain amount of nutrients intravenously, and we can reach a certain potency in the blood to produce a very therapeutic response. But supplements are a daily part of my life, and I don't want to get away from that. We can't. We need that support. But like you said, these nutrients are found in our foods, except for they're just not in high enough quantity to do what we need them to do.
Very well said. Yeah, I think in both camps, the infusion camp and then the supplement camp, it can get drawn out to an extreme. And I think the presence of both is really beneficial, especially because you need support from all sides with what we're talking about with toxic load. Kind of in functional medicine, we talk about allostatic load, just the inability of the body to properly adapt to the natural stress responses that take place, whether in the presence of chemical toxicity, hormonal toxicity, or just hormonal stress.
Yep.
So I'm wondering, a little bit more about the infusions that you offer. I mentioned the Jumpstart program. So part of that Jumpstart program is an infusion of glutathione, which is a really potent antioxidant and phospholipid. So, tell the listeners a little bit about glutathione and what it can do for their athletic performance.
Well, glutathione is a natural antioxidant that is produced inside of all of our cells. It is what's considered to be an intracellular antioxidant, protecting the cell from the inside out. And when we introduce glutathione in an IV, it absorbs into the cells within about 15 minutes. It doesn't have a whole long lifespan in the bloodstream. It absorbs quite rapidly. When glutathione absorbs into the cells, it does help to push toxins out of the cell that currently are there. And it also helps the liver to turn what are called lipid-soluble toxins into water-soluble toxins. And thereby they can be excreted both by the liver and the kidneys, and it helps to relieve the burden on the liver itself. So, glutathione is stage 2 in the Jumpstart program. We typically start with phosphatidylcholine as stage 1. And phosphatidylcholine is a phenomenal phospholipid that, again, is found naturally occurring in the plasma membrane of all of our cells and is in high quantity in the brain and nervous system. Phosphatidylcholine, when introduced through an IV, will bind to lipid-soluble toxins, kind of like a chelator, and it will scrape fats from the blood vessels, and those fats are conveniently bound to the lipid-soluble chemicals. And so you're getting both increased blood flow and detoxification at the same time. What I really like about phosphatidylcholine is not only just increasing the blood flow through the main blood vessels, but also through the liver and the kidneys. There's a tremendous amount of blood vessels and blood flow through those two organs that over time, particles of fats can obstruct that blood flow. And so we'd like to get as much of that out as possible before we introduce the glutathione, so that we get maximum absorption to those cells. And then going from the glutathione, we get into alpha-lipoic acid, which is another antioxidant that helps to recycle glutathione. And so if you go through this multi-stage process, each stage builds on the next. And at the end of it, we hopefully have a healthier, stronger individual that is of a much cleaner environment internally.
Absolutely love it. I'm really fascinated by what you're talking about with lipid soluble versus fat or water soluble, I should say, toxins in the body. And so in terms of athletic performance, let's say somebody goes to the gym maybe 3 or 4 times a week, or maybe they're an endurance athlete, for example, and they're shooting a bunch of gels, or maybe they're drinking a lot of Gatorade, and typical products on the market that are branded and marketed to be beneficial for the athlete, but actually may have some toxins in there. So let's say you take somebody who is experiencing kind of that level of toxicity, and how do you think specifically, these therapies and infusions could help that person with their performance in the gym?
Well, interestingly enough, I mean, we use those drinks as electrolyte recovery and also sugar recovery, right? Because you're burning all this glucose or glycogen, essentially, that's been stored in those, either the liver or the muscles. And you're trying to replenish those things. And of course, replenishing the hydration, the water and electrolytes that you've lost through the sweating and cellular respiration. And you can have an elite athlete that drinks Gatorade and slams those little gel packs on a daily basis. And that person will probably not notice much from the mild amount of, like, let's say, artificial flavors or colors, or even the plastics that could be a part of that drink or that food. But if you start looking at the natural ways of doing those same electrolyte recoveries or carbohydrate recoveries, they're packaged in something almost identical. And so it's not a matter of if you go organic or if you just go straight Gatorade or whatever brand you choose. It's about helping the body to remove the byproducts of that particular drink or snack. So plastic molecules, big factor when it comes to any sports drink. I don't know of a sports drink that comes in a glass bottle. And especially just because you don't really want to have glass at a gym or around a pool or a track, because it's easily broken. So if you have your sports drink or your electrolytes in a plastic container and it's in the sun, it's going to warm up. You could possibly have some plastic molecules that get absorbed into the fluid. When those go into the body, they're what are considered to be a more permanent toxin. I mean, they essentially don't break down in the environment and they get stored in the body. So phosphatidylcholine can really help to bind to those things. And honestly, Zabi, I don't have any studies to go along with that. We're just basically relying on the principles of the phospholipid binding to the fats, and those fats being so sticky that they would absorb some of those plastic molecules as well. Some of those plastic molecules are also called xenoestrogens, which meaning that they are an artificial form of what looks like estrogen, even though they're not a hormone, but they fit into the same receptor sites as that hormone. And so if we can pull those out of the cells, it helps with long-term health more so than immediate noticeable changes. So if you took an elite athlete and you said, okay, well, I want you to, like an ultra marathon runner, you run 50 miles and you can do that in a specific set of increments or time. Then we do these detox therapies. Will they be able to run faster or feel better afterward? Probably not run faster, but the recovery time and the amount of time that it takes for their body to heal after those events would be decreased. It may be very small decreases, but overall, over a 10 to 15, 20-year period of time, that could be substantial in long-term health, not athletic performance. So whenever I'm working with an athlete, I'm not so much looking at the immediate unless they really need help improving. What we're looking at is long-term health and the breakdown of the tissues because they're training so hard and they're stressing their body so hard. And we try to help to build them up along the way. And if their times get faster, their reflexes get quicker, their endurance gets better, they get stronger, muscle tissue grows better, fantastic. And we help along those lines as well. But really for me, and especially for the practice, it's about the long-term health. We look at things 5, 10, 15, 20, 40 years down the road, especially with our younger athletes who are in high school going into college. They're getting scholarships, they're training hard. They have pressure from their parents, their peers. They have scholarships on the line, or perhaps even Olympic trials. They're going to make it into the Olympics at some point. They got a lot of pressure. So they're pushing their body a lot harder. And I want to help them get there. But mostly what I want to do is help them prevent long-term damage from wearing their body out. It's just like any other engine. A race car, you race it hard, that engine's going to fail a lot sooner than the, to and from work, cruising down the road at 35 miles an hour, just having a good time. So.
Very well said. I love what you say about just kind of long-term picture and making sure that clients, whether it be athletes or whether it just be kind of the everyday person, has the metabolic resources on board in order to create long-term energy, well-being, and maintain that homeostasis in the system. Because over the course of, like you said, 15, 20, 40 years, in our society, one will be exposed to a tremendous amount of toxins. And with the way that our industry works, you may be exposed to a toxin at 55 that didn't exist when you were 20. And right. The liver, the detoxification organs have a really hard time processing that. It's just not something that's natural to the body. So I think these detoxifying therapies are hugely beneficial for creating that long-term health and well-being. Taking it kind of into athletic performance, you see this a lot, especially in football, but contact sports, the prevalence of TBI in athletes. Um, and so when we're talking about brain health, of course, we want to include detoxifying agents and really understand how they can influence cognitive function. But then you take kind of an acute stress in the form of TBI. And I'm wondering, what do you provide for athletes that may be experiencing the hugely detrimental symptoms of TBI?
You know, that's something that's becoming increasingly common as far as awareness, especially with chronic traumatic encephalopathy. High school football players being studied. We've got professional athletes. They're making the media the news all the time because of the injuries they've sustained and the effects that it's having on them psychologically. Conveniently enough, I have worked with fighters for a very long time. I believe I started working with the first fighters here in Albuquerque around 2008. And of course, fighting was already established here. We've got some great fight camps. But I did primarily work with boxing, kickboxing, Muay Thai, and MMA fighters. Along the way, I ended up starting to try to train like them. And at one point or another, I may have gotten into sparring and possibly even maybe had an amateur event once or twice. I learned a great deal by experiencing what they go through on a very small scale compared to what these pros are doing, but it gave me a better understanding of what they felt and also the effects that could be happening long term. So I started looking at that, and we started looking into the blood-brain barrier. First of all, you start creating the small repeated traumas that increase the inflammation in the brain, decreases blood flow to the brain, and then the very, very interesting degradation of the blood-brain barrier, allowing for chemicals from the environment to come into the brain in ways that it wouldn't normally, and in higher levels than would normally be found. So we started looking at ways to repair that, and we got into hyperbaric oxygen therapy to decrease inflammation and cerebral spinal fluid pressure in the brain. We started looking at phosphatidylcholine to help with the membrane itself, the blood-brain barrier, and also, of course, alpha-lipoic acid for that. We got into peptide therapy, protein peptide injections just here recently within the last 6 to 8 months, and we're seeing some phenomenal changes there. But perhaps we should look at hyperbaric oxygen therapy first, if that's all right with you.
I'm game. Let's do it.
So hyperbaric oxygen therapy is not FDA approved to treat traumatic brain injury. It is approved to treat several other things, but it's quite limited in the scope of what it's FDA approved to do. So if we start looking at off-label prescribing, or that term, hyperbaric oxygen at its core increases oxygenation levels throughout the body. Essentially, it's a big oxygen bubble that we put these people inside of, and I actually love going inside the hyperbaric because it's very relaxing. And what you notice when you're in there is you're surrounded by normal ambient air in a big bubble. You have plenty of room to move around, so it's not like an MRI tube where you have to stay completely still. It's not extremely claustrophobic, but you do have respiratory oxygen that's being supplied at the same time through a nasal cannula or an oxygen mask. The respiratory oxygen is usually in a concentration of 97 to 99% pure oxygen, and the pressure that we are under when we're in the chamber can be anywhere between 1.3 ATA all the way up to 3 ATA. Now, that's absolute atmospheric pressure, and our particular chambers here at the clinic are between 1.3 to 1.5 ATA. We do not go into the high levels of atmospheric pressure, mostly because the most recent studies on brain health and neural regeneration showed a contrast between chambers pressurized at 1.3 ATA all the way up to 2.4 ATA, and there was no statistical difference in outcome in either pressure. Essentially, you can go into a lower pressure and you can get the exact same brain response that you would get at a higher pressure for specific things. It's not for everything. Of course, you may need higher pressure for the extreme physical traumas. But let's say you have somebody who has a traumatic brain injury from a car accident or a slip and fall, a direct blow to the head. Immediately, the cerebral spinal fluid pressure increases, the brain swells. Hyperbaric is fantastic because the pressure that's essentially being pushed on by the chamber, and it actually suppresses the inflammation in the brain and in the tissues throughout the body. So it's an artificial anti-inflammatory. Second part is, as you're breathing in that respiratory oxygen, it's oxygenating the plasma throughout the bloodstream. That plasma is also under pressure, and that's being forced deeper into the tissue and deeper into the cells. And if you think about a can of soda or carbonated water, there's the carbonation inside of that fluid. Because it's under pressure before you open it, those bubbles are so small you can't really even see them. But as soon as you pop that lid, if you look inside of a glass with carbonated fluid in there, you'll see all of the bubbles effervescing, right? Everybody's experienced it. If you shake up a can of soda or something like that, open it up too quick, you get that spray all over the place. When you're under pressure and you're in the hyperbaric chamber, the oxygen that you're breathing in, those bubbles that are going through into the lungs are being pressurized and being forced very, very small into the plasma. And they're being pushed throughout the entire system. And as you come out of that pressure in the hyperbaric chamber, those bubbles begin to expand. Now, if you use a lower pressure chamber like what we have, you don't have to worry about an embolist. You're not going to create a huge bubble all of a sudden, like divers do if they come up too quickly from a deep dive and they get the bends. Now, higher pressure chambers, that is an issue, and you have to depressurize very slowly. In our chambers, we don't have to worry about it nearly as much, but the same principle applies. We're essentially compressing all of those oxygen bubbles, and we're forcing that plasma deeper and deeper into the tissue. And then as they come out of pressure, that hyperoxygenated plasma begins to deliver all of the oxygen throughout the cell surrounding. And so it's quite phenomenal. And some of the benefits on hyperbaric oxygen, within just 3 sessions, studies have shown that it becomes neurogenic. It helps to regrow neurons in the brain, increases the angiogenesis, which is the blood vessel formation throughout the body. And then, of course, the anti-inflammatory and decrease in the cerebrospinal fluid pressure. And so as far as the statistical difference in hyperbaric oxygen and traumatic brain injury, I do have some stats, if you'll give me just a second to pull those up for you. I did find them to be quite interesting. Just to give you some numbers, I wanted to get you a little bit more data on that.
Sure, absolutely. And in the meantime, I can say that especially for athletes who are training at high altitude, like we are here in New Mexico, oxygenation becomes a big issue. We're not as blessed as those who are training at sea level, but even then, just because you're at a different altitude doesn't necessarily mean that your cells and the plasma is uptaking oxygen the way that it should. And so I think for those who, in some corrective exercise, we talk about an inverted breathing pattern, which is the inability to breathe diaphragmatically. And a lot of proper bracing and technique when it comes to corrective exercise is knowing how to pump the abdominal wall with the diaphragm properly to stabilize your lumbar spine. And we think about that in exercise, but rarely do we take that out into our daily lives. So a lot of us are either hypo or hyperventilating throughout the day due to stress and due to the impact of different hormones in the body. And therefore, there's a big issue with oxygenation in most people. And so I think the hyperbaric oxygen therapy is a great way to go, whether you're an athlete or just the common person, to really increase the efficacy of oxygenation in the body, which, as you could definitely expand on, has many different physiological benefits.
Yeah, I've actually been more on the side of training at higher altitude as I was doing all of my training, and of course working with the fighters. If we train at higher altitude and you compete at a lower altitude, you're going to have a substantial advantage. We did see a lot of events where fighters were coming from sea level up to, like, let's say Ruidoso, which was about 9,000 feet. And they would gas out within the first few minutes of the fight. And it was just an amazing thing to physically sit there and watch them just get more and more fatigued. And then you have our guys who are, I mean, they're working hard, but they're not having to work nearly as hard, and their endurance is going and going and going. And it was a marked difference. So I've always been a fan of, I know a lot of people are not a fan of the CO2 rebreathers, like the elevation mask. I've always been a fan of that. And it's more of a psychological thing for me, making it harder so that when I don't have it on, I can feel better and go further. But, back to the hyperbarics, there's a 39% reduction in post-concussive symptoms, being a decrease in headaches, nausea, and dizziness. And after TBI, you get a concussion, those are the most prevalent symptoms. So if you have a almost 40% reduction in those symptoms within just a few treatments, that's huge for lifestyle or for quality of life. If a person is able to achieve 40 hours of hyperbaric within a 30-day period of time after traumatic brain injury, Dr. Daniel Amen did a really nice presentation on his findings in June of 2018 at the Hyperbaric conference in Costa Mesa, California. What he found was that he saw if a person was able to achieve 40 hyperbaric treatments or hours within a 30-day period of time, they not only had the 39% reduction in post-concussive symptoms, but they also had an increase in IQ and cognitive function, a decrease in depression and suicidal thoughts, a decrease in PTSD, and a marked increase in quality of life and blood flow to the brain. Now, Dr. Amen is phenomenal, and he has way, way more data than I could ever possibly give you. He is the brain expert, in my opinion, and my hat is off to him as far as his knowledge base. It's phenomenal. Learning what I did and applying that to our practice with patients who not only have either TBI, but maybe, let's say, dementia, Alzheimer's, Parkinson's, cancer, your average individual who just wants to be healthier, be happier, and have a better outlook in life. Anybody can do hyperbaric. It is extremely beneficial. It can add to your energy level. It can decrease your aches and pains. What most people experience after just their first treatment is a little bit better well-being and perhaps a little bit of elevation in mood. I know you get a little bit more oxygen, it makes you happy. And I know there are a lot of people out there who are seeking ways to become happier in artificial means. I'd rather go natural and give them something that's going to be beneficial at the same time.
That's huge. Like you said, a lot of people are seeking happiness in the wrong ways. And when it comes to health and well-being, I think there's a pretty robust industry that sells a lot of supplements and a lot of quick fix diet pills and so forth. That, diet aside, really, just quick fixes for different physiological deficits that can be almost, I won't say healed, but can be supplemented with more natural means, like you're saying. I think hyperbaric oxygen is a wonderful way to go, whether you're an athlete looking for better recovery, or somebody who just wants to, like you said, have a better mood throughout the day, a little bit more mood regulation, or somebody who's recovering from TBI and nausea. All the symptoms of dizziness that are associated with TBI are really unpleasant, especially if it's acute, right? So if somebody is just coming to you right off the bat, how many sessions would you like to ideally start with them in order to really get the benefits of HBOT?
We always suggest doing one treatment. So just, start out with getting in the chamber. I'll be honest with you, my first time in the chamber, a little unnerving. All of a sudden you're in a bubble. It is making some funny sounds as the pressure is increasing. It's very similar to when you go up in an airplane, you feel the pressure in your ears, and you have to allow the pressure to inside the ear and the outside of the ear to adjust. And so you have to constantly clear them. It can be a little painful if you're not able to clear it fast enough. And so you're going to have to communicate well with the hyperbaric technician to make sure that they know not to increase pressure too fast for you if you're having trouble. So we suggest going one time, see how you do with it, see if you enjoy it. We don't want to do things that people don't enjoy, first of all. If a person is claustrophobic or if they have panic anxiety disorder, we have different treatments that we can use for them to help them get through that first session, or perhaps if they want to try it again, get through their second session. Most people who get through there for the first time around, they end up buying a package, and we do packages of 5, 10, and 20 hyperbaric oxygen sessions. I do always go with the 40 hours in the chamber within 30 days, if at all possible. Financially, that may not be feasible for some folks. But if we do that hypersaturation, they begin to experience the benefits much, much faster. And they also can recognize the benefits. Sometimes when you do 1 or 2 here or there, you don't really see enough change, or like I guess you could say you don't notice enough personally. Uh, Other people may notice that you, like, let's say, are less irritated. You have a little bit more patience with them. Your mood is a little bit better, but you personally may not recognize that. And so, I do suggest that if a person cannot do the 40 hours within 30 days, try to do 1 to 2 sessions a week for about 4 weeks. Okay, at least give your body some time to get that oxygen, increase the immune system, decrease inflammation, and then reevaluate after that 4 week period.
Fantastic. Absolutely. Um, and having experienced it myself, I can say that I think the impact is pretty pronounced, I should say, right off the bat. Um, you know, if I were able to do it over 4 weeks and do it once or twice a week, I think it'd have a really significant impact. But I certainly felt it quite a bit off of the first session. Um, just yeah, not only mood regulation, but just kind of better energy flow. Um,
Mhm.
so for athletes who are just looking, let's say, to like increase muscle mass, or they're seeking just to improve recovery, what infusions, like, give us maybe one or two, would you recommend for that goal?
We, being the name of the company is Micronutrient Infusion Services, we have our IV that is the most well-rounded for this particular purpose, which is called the Micronutrient IV. And it's basically the best synergistic combination of nutrients, being vitamins, minerals, and amino acids, that we could put together in one formulation. So it does have vitamin C, calcium, magnesium, trace minerals, a full complement of B vitamins, and amino acids. And I believe there's about 23 ingredients total. It does contain NAC and glutathione as well. Carnitine is in there, and it's essentially something that will help to increase protein synthesis, decrease inflammation, increase elastin production, boost the immune system, and shorten recovery time after workouts. A lot of bodybuilders love it because they're getting the aminos straight into their bloodstream. They don't have to worry about absorption, and they notice bigger gains. Endurance athletes are going to like it mostly because it decreases the recovery time, and they notice a difference in the ligaments and tendons. They have substantial decrease in inflammation. I like it for endurance athletes, especially because of the vitamin C supporting heart function, and it also essentially is just the most well-rounded formulation that I could possibly develop. We use it for pre and post-surgical applications as well. We do have patients who, they do heavy lifting, they're power lifters, they get a hernia. Or let's see, of course, those professional fighters, they get pretty much every injury you could imagine, and they need to heal before their next fight. So we'll load them up if they can use IVs. Certain fighters cannot, certain athletes cannot, because of the World Doping Association, or USADA, United States Anti-Doping Association guidelines. So of course we abide by those completely, and we want to make sure we follow the rules. Other athletes who can use those formulations, we do. Something else that we use for athletes on a regular basis are the protein peptide injections. What's fantastic about protein peptides is that they are amino acids that are specific to tissues or body functions, and they are self-administered. The patient can actually take the vial home with them and the syringes, and they can administer their own injections at home. They don't have to come to the office to do it. Now, they don't take the place of the IV, but they augment the IV and the hyperbaric therapy. And so if you want to have a very well-rounded program, the suggestion would be hyperbaric oxygen, the IV therapy, and the protein peptides, along with your training, your supplements, your emotional or mental work. If you do any meditation, hypnosis, it's got to be a well-rounded picture that we're putting together for folks. And we only offer a small, specialized amount of these services, obviously the things we've discussed, but that's not the entire picture for what makes an athlete or a competitor great. And I know you've got listeners and viewers that are not professionals. That doesn't mean that they can't have the athletic edge that they've always dreamed of having. They don't have to be a professional competitor to feel great, look great, and perform great. And I think that it's important that everybody understand that This is not just for the elite, it's for your everyday average individual, whether you're starting out and you weigh 300 pounds and you want to lose weight, you want to feel better. And by the way, if you do want to lose a substantial amount of weight, you're going to need to detoxify, because a lot of people, as they're losing weight and they lose it very quickly, they get sick. They have a lot of toxic burden that they're releasing onto their liver and their kidneys. But if you have, like I said, substantial weight loss, that's your goal, or if you are just, a mom and you've had a baby and you're just trying to get back into shape, you're going to need some nutrients. We're going to help you out. If you're a dad and you haven't worked out in 3-4 years because you've been working and you've got kids and you want to get back to the gym, but you're older and your recovery is slower, that's also something we can help with. Everybody's body's going to be different. This is just an overview. We customize the programs to suit everybody. And I think that's the way things should be. Not everything is going to work for every person. And I think that your training in particular, Zavi, you've learned a great deal about that. And you have a completely different perspective from ours, in that it is synergistic, but you look at things in a foundational way that is different from what we're trying to do with foundation, and they apply and they work together very, very nicely.
Love it. Yeah, I think that's a great point. My goal is to have the breadth of knowledge that you bring to your practice and integrate that into kind of the lifestyle factors that I coach clients to master, because you can get all of the best infusions and do all of the best therapies, but without, like you said, augmenting with the proper lifestyle, hydration, nutrition, sleep, your thinking, your breathing, and your movement, things can still be out of balance. Likewise, you can do all of those things correctly, as I've experienced before, where I'm like, all right, I'm sleeping well, I'm eating organic food, nutrient-dense food, organ meat, so forth. But there's something in my system that's just not getting to that level of performance that I'd like to experience. And like you said, those two come together really, really well. And I know if I could, I'd spend every day over there getting an infusion or two, because it'd make me feel great. But yeah, I think the marriage of the two is really important, and I know that you're a huge fan and take care of yourself very, very well, as best as you can with as much as you're doing, for sure.
Nobody's perfect,
Nobody's perfect, but I think I've for sure been inspired by you in my journey, just not only in self-maintenance and management, but also just in studying and memorization and integration of the knowledge. So not just being able to spread it off the top of your head, but I think you use the wisdom that you have to really carefully, like you said, guide and assist a patient's treatment plan over time. So, kind of to end the podcast, I'm wondering, where can people find you? What do you recommend for first-time clients, and any last messages you want to share?
Well, first of all, we just primarily, we focus on very specific things. Like you said, it has to be a well-rounded picture. So for the information about our clinic, it can be found on our website, which is ahctherapies.com. We're also on social media. We're on Twitter, Facebook, Instagram, at MicroInfusions is the tag you want to use for that. I do free consultations for the first 30 minutes. If a person's new, they just want to kind of explore this as an option, I'll sit down with them. I'll talk with them about what we do, what we can provide, get a little bit of information about what they're looking for in their body, in particular, their history, and then go from there. And during that consultation, I'll actually, recommend a lot of the things that you're talking about that we don't do, because people need to know this is not the end all for everything. I go to yoga, I work, I meditate, I try to do as much as I can as far as diet, nutrition, and healthy lifestyle. This is a part of it, and what you offer is a part of it, but there are so many other pieces to that puzzle that I don't know everything. I don't try to know everything, and I just try to be good at what we do, and I try to help people the best that I possibly can.
I think at the end of the day, when you play your piece in the larger whole as well as you can, rather than disposing yourself to what a lot of health practitioners do, which is try to be everything to everyone, you can actually help your clientele and your patients that much more, because you take on a hat of specialized knowledge, and you're able to really apply yourself in that avenue. And of course, as I know you are, and as I try to be open to the other pieces of the pie, to learn and constantly grow and see where you can expand in not only your practice, but really teaching people how to regulate themselves and know what they need the most is a big part of what I do with clients, and just trying to get them to listen to their body, know what it's saying, and then act and interpret those inputs accordingly.
Excellent. Absolutely. I agree.
I love it. All right, Chris, it's been a total pleasure having you on the podcast today. I hope that everyone in the Albuquerque area goes and checks out Micronutrient Infusion Services. There's one on Ellison, and then there's a new one on the west side. Is that correct?
We haven't quite announced that yet, but there is one coming. We also have a mobile unit that we're going to be doing some different events throughout the city with hopefully certain companies that I'm trying to specialize treatments for, whoever their clientele is, whether it's a spa, a gym, a yoga studio, CrossFit. We'll be down at Elephant Butte for Memorial Day, providing hydration IVs, hangover IVs, B12 shots, some of the fun stuff at a different location than our current site. But yes, there is a west side location coming, hopefully to be open by July, and hopefully you'll have me back on your podcast so we can talk a little bit more about that.
I love it. Absolutely. You are welcome anytime. Thank you for everything you shared here today. And in the meantime, everyone go check out his resources online, ahctherapies.com, and Facebook, Instagram, Twitter. And in the meantime, thanks for listening. Hope you all enjoyed, and we'll be back on soon.
Thank you, Zavi.
You bet.